Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
The University of Michigan Television Hour.
In a report on research, diagnosis, and treatment, we bring you to the frontiers of health. This series tells you the progress being made by medicine, dentistry, public health, and the other health sciences in man's eternal struggle against illness. This is program 11, dealing with tooth decay. You're going to see the progress which dentistry has made toward the elimination of cavities. Now here for Frontiers of Health is Adelia Bucas.
One of the fondest dreams of dentistry is the prevention of dental caries or tooth decay. And I might add that this really is one of the hopes that we all share. Of course, having a tooth filled today is quite a different experience than it was in the old days, when we might have been so frightened of the dentist drill that we would be tempted to turn around and walk out of his office, unless, of course, the pain was already unbearable. But today, most of us have been educated to the need to go to the dentist for regular examination visits. And then the cavities are recognized rather early. The fillings are put in, and frequently quite painlessly. But no matter how clever these dentists get at painless treatment, I'm sure we would all rather prevent dental caries than have them occur. And I'm happy to report to you that a great deal of progress has been made and will be made. And we're going to demonstrate that for you today. And our guest is Dr. Phillip Jay of the School of Dentistry. Dr. Jay is a national authority on the subject of dental caries or tooth decay. Dr. Jay, why don't we talk first about what a cavity is and how a cavity is formed, and then let's go on to the perhaps more optimistic side of the story. Can we prevent dental caries? But first, what is a cavity?
Well, a cavity is the result of a rather complicated process. And I think we can simplify it a little bit, and that's what we'll try to do now.
Fine, fine.
The first step in this process is the formation of a film on the surface of the enamel, represented here. It's a very hard tissue. It's the hardest tissue really in the body.
Well, this is the enamel right here, then.
That's enamel.
That's the hard part.
And the film is formed at this point. And that's made up of many bacteria and the sticky, mucinous substance from the saliva and anything that happens to accumulate in the mouth that isn't used in any other way, it seems, makes up this plaque. And if this plaque contains bacteria which are able to produce acid from sugar, the trouble begins. The first thing that happens is, and these bacteria are lactobacilli. We're going to talk about those quite a bit, so we might as well define them. Lactobacilli are called bacilli because of their shape, their rods, their bacilli, and they do produce lactic acid.
And we can't talk about diet and dental caries without using the word lactobacillus,
Well,
that's for sure.
Not with our method here. We'll see why as we develop it. The first thing that happens then is this acid is formed, and it dissolves this very hard tissue in a rather curious pattern, sort of a V shape. And then after sufficient of this becomes dissolved, it spreads at this junction between the two tissues. This is the enamel, and this is the dentine. The dentine is more like bone. The enamel is nothing like bone. It's much harder than bone.
The enamel actually is the hardest tissue in the body, isn't it?
Yes, and nothing happens to it. It's not capable of repair. If you fracture a tooth, nothing happens. It remains fractured. As a matter of fact, dentine doesn't repair itself either. It's a rather serious condition that when anything happens to it, you've got to interfere and remedy it. It won't cure itself. Well, then when it spreads out at this point, the acid proceeds further up to the pulp. This is the pulp. It contains the blood vessels and the nerves. That's what you feel.
And so that when the cavity reaches this point, we really know we have one.
You know it before it gets to that point, but when it gets to this point, it's too late. Well, then let us say that this continues to dissolve the mineral salts here, and then there's some other factors in the dentine. It's much more complicated than the enamel. But let's just say that something happens and it disintegrates. Then a cavity is formed, very much like that.
And then the only thing you really can do is to put something else where the cavity was.
Yes. Well, fortunately, we can stop this process by removing the affected material. And that's done by, well, you know.
Oh, yes, having
You've
a filling.
had it done. In
I've
fact,
had a few.
in fact, everyone has had it done. If that's removed carefully and sterilized as well as we can, and it's almost impossible to get aseptic or completely sterile conditions there because the whole mouth is so contaminated. It's very difficult to keep the saliva out. But however you do the best you can and treat it with certain chemicals and scoop all of this out and then replace it with a filling so that a filling of a material, gold or some insoluble material that can no longer decay. Now, of course, this isn't the way the dentist would do it. If there were another tooth here, he'd have to protect it. So he'd cut the cavity way up in here.
So that actually you're removing the area that's been destroyed by the cavity and replacing it something that isn't soluble.
Yes, and you must also replace some of the sound material, too. Otherwise, decay will recur around here. It must be brought out to an area where it's rather self-cleansing. So that every time you eat, the motion of your tongue and your lip will prevent bacteria from stabilizing here.
Well, now, Dr. Jay, do we know exactly why that sticky mass that you call a plaque forms on a tooth?
We don't know all about it, but we certainly know something about it. We can differentiate between a safe one and one that isn't so safe.
Well, now, do all people develop cavities like this, or are some people immune?
Well, there are immunes, but not very many.
Uh-huh.
I'd say less than 5% of the normal population are immune.
Well, now, say that the individual had had fluoride in his drinking water. What effect would that have on the development of this cavity?
Well, the inclusion of fluoride in the surface of the tooth or throughout the enamel makes the tooth much less soluble in acid, so that it would take a great deal more acid a longer time to produce this result. And then again, Bucus, there's something about the fluoride that influences the type of bacteria that grow upon it, because lactobacilli are not there in great numbers, as the tooth has fluoride in it.
Well, now you demonstrated to us the end result of a cavity. I mean, here we have a cavity. But after all, we're particularly interested in the prevention of them. Let's not have them if we can arrange not to have them. Now, would it be possible, Dr. Jay, with the use of a toothbrush and some kind of special tooth powder or toothpaste, to brush over this plaque, this sticky mass, and remove it so that we would not develop a cavity?
Well, of course, it's rather difficult to reach this area with a toothbrush because really, in relation to its neighboring tooth, it would be here.
And it's almost impossible to get in there with a toothbrush.
Very, very
isn't
difficult
it?
to get a toothbrush there. Now, suppose we could reach it with a toothbrush, and there are areas in the mouth where you can. The part of the teeth that you see, actually. You could reach with a toothbrush, couldn't you?
That's right.
Well, now then, dentifrices weren't of very much value, only in that they make you want to keep your teeth clean. It's rather pleasant, if it's a pleasant dentifrice. But recently, there's been considerable research trying to incorporate something in the dentifrice that would either destroy these bacteria, and we have no way of doing that. That doesn't work at all. And theoretically, it's possible, as you know, to incorporate with the sugar, which is so necessary. And we didn't say anything about that. We talked about lactobacilli.
Yes.
We didn't talk about sugar. Without the sugar, the lactobacilli wouldn't survive, nor could they produce the acid. Now, as you know, it's possible to incorporate with sugar, theoretically, what we call an enzyme inhibitor, an anti-enzyme, which simply means, as you certainly know, that the sugar is simply not changed into an acid. That process is interfered with. Now, there are anti-enzymes in the test tube. Some of them have been tried in dentifrices, but it'll take a great deal of testing. There have been some reports that are not too bad, but they must be confirmed.
But they must be confirmed. We can't put all of our hope yet into
That's
what we
right.
brush onto our teeth, certainly.
That is why the Council of Therapeutics, which tests those things or evaluates them for the American Dental Association, is not ready to accept these as therapeutic or decay-arresting dentifrices at the present time.
But you certainly would go along with the suggestion that the best oral hygiene we can possibly practice will have its advantages.
Oh, yes. Toothbrushing is very important for the protection of these tissues, the gum. Now, if that becomes inflamed or diseased, and if it progresses down the tooth root, you lose the tooth, you see. So tooth decay is not the only thing we're concerned with. And toothbrushing is the one way to prevent the beginning. That's one of the ways to prevent the beginning of this process. So toothbrushing is important, although we can't depend upon it too much for the prevention of tooth decay.
It won't do anything quite miraculous.
I
Well,
don't
now
think
let's
so.
take a look at the second way that the dentist suggests we can help ourselves in the prevention of dental caries, and that is the use of the restricted sugar diet. After all, you mentioned when you used this large word lactobacillus that the lactobacilli had to have some sugar if they were going to grow and multiply at the rate that we see when people do develop dental caries.
Well, of course, that's our way. We like to talk about that. The sugar, of course, is the injurious agent in this particular case. And we have found through experience that if the sugar in the diet is restricted to a low enough level, these bacteria, the lactobacilli, disappear. They're unable to survive. And when they do disappear, they are replaced in this plaque by organisms with which we're not concerned. They're not harmful insofar as we're able to determine it
Yes.
at the present time.
Well, actually, this concept of the relationship of sugar to the production of dental caries or cavities was developed here at the university, wasn't it?
Well, we've done a great deal of work on that, attacking it from two directions. First, from the history of tooth decay. We know that in those primitive races where sugar isn't available, they certainly don't have tooth decay. We also know that these bacteria will not grow without sugar. And they certainly cannot produce the acid without sugar, or sometimes starches, but not always. And so we have this method of not only curtailing, reducing the growth of the bacteria, but we remove from the mouth the material which is necessary for the production of the acid.
So we starve the bacteria and they don't get along very well. Well, Dr. Jay, let's imagine that we have a patient who has eaten a good bit of sugar in his diet and he has lots of these bacilli in his mouth, and he's going to go to see his dentist. Now, I'd like to show our audience and leave you for a moment, if you will forgive me. I'd like to show the audience what happens to a sample of saliva that your patient has produced. He's chewed some paraffin, I think you've mentioned previously, in order to try to get some of this stuff off the tooth. Is that right?
Yes, that helps not only remove material from the tooth, but helps stimulate the flow of saliva.
So we're assuming that our patient has his saliva, and he's taking the saliva over to his dentist, and the dentist is going to have a laboratory study made of that saliva. And in order that you may see how this particular test is done, we have as our guest tonight Miss Mary Louise Noel, who is a bacteriologist in the School of Dentistry. Miss Noel, will you demonstrate for us exactly what you do with a little saliva that our patient has presented to you?
When we receive the specimen of saliva in the laboratory, we make a dilution of it in broth. And that broth is spread on the surface of an agar plate.
When you speak of broth, broth is something that we humans eat. Is broth a food for bacteria and bacillus and
Yes,
that sort of thing?
It's the same sort of thing. It's made from meat infusion, and it's necessary to provide nutrients for the bacteria. Now here you have a sterile plate, and it is made of tomato juice and chemicals and an agar to solidify it.
So this actually is the food on which these lactobacilli are going to grow.
Yes, that's right, Miss Bucas. Now, after the saliva has been spread on the surface, we put the plate in the incubator where we leave it for 4 days to allow the bacteria to grow.
Because the bacteria need a little heat and warmth as well as food, don't they?
Yes, they grow at body temperature. This is a characteristic plate after incubation, and we have a special setup here, and I will let you see the colonies as we see them in the laboratory.
Actually, these have multiplied at a tremendous rate within a matter of a few days, haven't they?
They certainly have.
And this is then the kind of a plate you would see with this big multiplication of the lactobacilli in my patient who had too much sugar in his diet and a lot of cavities.
Yes. And assuming that each one of these arose from a single lactobacillus in the mouth, we can readily determine the lactobacillus count or the number of lactobacilli in the saliva.
And those little squares we see in the back, that was just a means for you to count the lactobacilli more easily. Is that right?
Yes.
Mm-hmm.
In this particular case, we would recommend the low carbohydrate diet for that patient. In contrast, we have here a plate which has very few colonies of lactobacilli. And in this case, the diet is not recommended.
So that if the patient's saliva, when it is cultured on this particular broth, this food, if the saliva culture does not show a growth of many lactobacilli, you assume that the patient is not susceptible to cavities at the time, and you're not going to suggest a low-sugar diet. But I take it on the one that looks like it's just crowded with the growth of these colonies that we will suggest a low-carbohydrate diet. Is that right?
Yes, we will report to the dentist, and in turn, the patient will follow the low-sugar diet.
Well, thank you very much, Miss Noel. And now we're going to ask Dr. Jay to tell us just what is going to happen to our patient who has a high lactobacillus count and is quite willing to cooperate and go along with a restricted carbohydrate diet for a few weeks.
Well, let's start with a patient who is really susceptible and has a very high count. Let us say 500,000. That's a
That's
nice
high
number to
enough,
start
yes,
with.
I think so.
We'll designate that at this level, right there. Now then, we want a diet for that patient that will provide sufficient energy and nutrients for the patient without supplying those nutrients and calories and acid-producing substances for the bacteria.
Well, believe me, talking with a nutritionist, I'll go along 100%. The diet is going to be adequate first.
Well,
adequate in absolutely everything the person needs. And
well, it better be because it's your diet. If you recall, what we did simply was this. We knew that we wanted the diet to contain not more than 100 grams of carbohydrate. Now, Lucas, why don't you explain what that means?
Well, I'd be very glad to. Actually, most of us eat about 450 grams of carbohydrate a day. So, Dr. J, when we lower that to 100 grams of carbohydrate a day, we're going to leave out the free sugar, the sugar you'd have in desserts and on your cereals and so on. And during the first 2 weeks, also, we limit the cereal products very much. Now, on this low-carbohydrate diet for 2 weeks, tell me what happens to the lactobacillus count, because this is going to be the payoff on the result of this particular theory we work
the
on.
lactobacilli do very poorly. They'll drop immediately.
They sort
down
of starve
to a
out.
level like that. They do. And this happens very, very quickly, so that the difference between very high Caries activity and no Caries activity at all is obtained overnight if directions are followed.
And then during the next 2 weeks, we want to be sure the count stays down, don't we?
Yes.
But we do add a little bit of carbohydrate to the diet, some potatoes and bread and a few things. But
Now, this happens to be the history of one particular case. This is not a significant rise at all.
It just looks big
first
on our
there were
chart.
500 lactobacilli in the saliva per cc of saliva, and this is 700, which means nothing. That's practically zero.
Practically negative, isn't it? All right, well, now during the last 2 weeks on this diet, the thing that we do is add 1 serving of sugar during the day and suggest the patient have it at 1 meal, but not at any of the other meals, because we're interested in seeing whether or not the patient can take sugar at 1 meal and still keep the count down. After all, that is our hope.
That's right. In this particular case, everything went beautifully. Went down to zero.
And then about how long is this going to stay down? Because if a person had to go back on a restricted diet all of the time, it'd be discouraging.
Well, we determined that by letting them eat all the sugar they like. In this particular case, went up to this level, which is very, very low. So eating the same amount of sugar that the patient had at this point, it remains at this point, simply because once you get rid of these lactobacilli, it takes them a long time to become reestablished. may stay down for 6 months or several years. In the event that it goes up, and I know that's what you're going to ask me, because everyone does, in the event that it goes up, we simply put them back on this diet plan, too, which contains all the starch they like, still no sugar.
And then it goes back down again.
We hope it does in most cases, and it does, in quite a few of them.
Well, now, Dr. Jay, we've mentioned the first two methods that we can use. One is good oral hygiene as a help, not the cure-all for dental caries, but as certainly a very desirable thing. And then secondly, we've mentioned some of the advantages of a low-sugar diet in a dental caries control program. Now, I'd like to ask you, how does fluoridation, our third approach, how does fluoridation fit into this picture?
Well, that's the easy thing to talk about.
But first, wait a minute. We say fluoridation very glibly, but exactly what do we mean by fluoridation?
Well, I was going to ask you to explain that, but I'll do it.
Oh, I wish you would. You're the dentist.
Well, what happens, by fluoridation, we mean the presence of a certain amount of fluoride, which is a salt of fluorine, which occurs in water. In many areas in the United States and many areas in Michigan, many of the wells on farms here
So it can be a natural part of water without anybody having it.
But we find that, and I want to stress the point, that what we're talking about now is no longer in the field of controversy from a research standpoint. Strangely enough, everything we've talked about so far may be considered to be controversial because research workers don't agree upon all these things, but they all agree on the fluorine aspects of it.
Well, now, in this whole fluorine story, you hear so much about the addition of fluorides to water for the sake of youngsters. Is it any advantage to a person as old as I am, sir?
Well, I think you're a little too late to get its maximum benefit.
I'm afraid so.
I'm afraid so. Just a little too late, because you should get it, from birth until about 8 years of age to get its maximum benefit. I don't think that you get very much from it after that. However, it must be remembered that if you get it at that time, you retain it through life.
Well, as long as there does appear to be controversy about the addition of fluorides to drinking water, Dr. Jay, we have Dr. Woods with us tonight, and I'd like to ask him a couple of questions. Dr. Woods is a professor of pharmacology in the School of Medicine and is a physician. And I'd like to ask you, Dr. Woods, because this business of fluoridation appears to be confusing to some people, what is the attitude of physicians and pharmacologists to the addition of fluorides to drinking water?
Well, I think that can be best summed up by the fact that a number of groups, medically trained and scientifically trained groups in this country, have endorsed fluoridation as being a very safe procedure. And those groups include the American Medical Association, the Public Health Service, the National Research Council, and a number of other groups as well. But I think the facts here speak more eloquently than do these endorsements. I think that is best illustrated by the fact that 1 million people in this country have been drinking water, natural water, containing fluoride, which is equivalent to that recommended for prevention of dental caries or more, without any difficulty, without any injury to health during this time.
And during a few generations, probably no one knew that they were even drinking water with
That
this.
is correct. And in addition to that, there are 800,000 persons in this country who have been drinking water to which fluoride has been added intentionally, drinking that for 5 to 10 years, and to my knowledge, there has been no proven case of injury to health in this group.
Well, thank you very much, Dr. Woods. It's obvious then that there appears to be no controversy among the scientists who have studied the problem. The controversy seems to be among some who have not studied the problem. And we thank you very much. And now I'd like to return to Dr. Jay and ask him, what about the painting of the fluoride on the teeth of youngsters? If water with fluoride added is so valuable, why is this other process used also?
Well, that's not used also. It's not used in connection with the fluoridated water. In those instances where the teeth have already been formed and if they haven't been exposed to the fluoride in the water when they were young, then it's necessary to paint a more concentrated solution of fluoride on the tooth in hopes it does the same thing. And it doesn't quite, but it is of some value.
You'd really rather have water supply with fluoride?
Oh, yes. You can reduce the extent of dental caries from 60 to 70% that way. And by painting it on the tooth, the maximum reduction is about 40% in cases of moderate caries activity.
Well, now, in rural areas where the people have their own wells, if they happen to have a water supply that does not contain this element fluoride, would you suggest then that these youngsters have a solution painted on their teeth?
Yes, I think that's quite important, if it's possible to get them to a center where that is being done or to their own dentist. The children who visit the dentist do get it, wherever it's indicated. It's not necessary to do it in a fluoride city, or that is a city supplied by fluoride water, because that's been tested. There's no additional benefit. But the dentist knows when it's supposed to be used, and they are using it quite generally.
And actually, a few thousand, or how many thousands of people would we say were benefiting right now because it was already added to their water or in their water naturally?
Well, as Dr. Wood said, some 800,000 people are being observed experimentally, but now there are over 1,100 cities using it as a practical measure. And so that expands that number up into the millions. There are 22 million people using fluoridated water at the present time.
Well, that is an excellent advance in the prevention of dental caries. Now, would you briefly summarize, Dr. Jay, the discussion that we've presented on ways to prevent dental caries in terms of our knowledge today?
Yes, I think the thing to remember, first of all, is to try to see that your city water supply contains the proper amount of fluoride. Sometimes it's just a question of adjusting it, because so many water supplies have it, you may need a little bit more. And it's a very simple engineering thing to do.
And it isn't expensive, is it?
No, it's not expensive. As far as water treatment is concerned, it's very inexpensive. And that's one thing that will work from a public health standpoint. And then, of course, even in fluoride areas, in cases of high caries susceptibility, it's necessary to restrict the amount of sugar in the diet. Now, if because the water is being fluoridated, you increase your sugar intake to an enormous extent, you may defeat the purpose of the fluoridation. And the dentists are a little bit worried about that, too. That you must continue to watch the diet to the extent that we're not so much interested in the patient's state of nutrition, because although nutrition is very important.
Well, I'm interested in that.
We know it's important, but you also know that it's not an index of caries susceptibility.
That's right.
Your state of nutrition may be very, very poor, and your teeth very, very good. We know that the only dietary factor that has any effect at all on the tooth decay level is the amount of sugar in the diet, and we have to watch it very carefully. Then we have mentioned the topical application of fluoride, the painting the fluoride on the tooth, the use of low-sugar diets, and oral hygiene to keep the teeth as clean as you can, because it serves a very useful purpose anyway.
So
I wish that in this last time that you tell us a little about your idea of the relationship of nutrition to dental caries.
Well, I feel very strongly, Dr. Jay, that all that we can do to help youngsters develop a pattern of eating that will provide all of the food that they need, and we know a fair amount about nutrition in this year, that at the same time they're developing this habit, that they would also use a very limited amount of sugar. I think the combination of a limited amount of sugar meeting all of the dietary requirements the youngster has is one that nutritionists urge. Thank you very much, Dr. Jay, and we thank Dr. Wood and Miss Knoll for being with us today. Next week, our subject is going to be polio. Our guest will be Dr. Thomas Francis, and he is going to tell us about the latest research in the fight against polio. So won't you join us next week for Frontiers of Health? Thank you.
Thank you, Miss Bucas. Any questions you might have concerning any dental problems can be answered best by your family dentist. Frontiers of Health is designed to acquaint you with the modern knowledge and techniques used in your behalf by all of the health sciences. Ted Nielsen speaking. This program was produced on kinescope film at the television studios in Ann Arbor. This is University of Michigan Television.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.